How would you briefly describe your project to someone unfamiliar with what you do?
Be With stands for belongingness and empathy with intentional targeted helping. And it's a short-term warm calling program. It's this innovation that we created to connect home delivered meal volunteers and providers who are affiliated with aging services that provide nutrition services to older adults who receive home delivered meals who may be experiencing heightened isolation, loneliness, and even elevated mental health distress, including suicide risk. And so we developed an 8-week warm calling program that's really designed to just provide a small dose of sincere connection. And we train the volunteers who provide these phone calls in some evidence-based training that's really designed to accomplish that, to have warm conversations, to know how to connect, and also to know how to respond to mental health distress.
What is the why behind your project?
Well, the why is that older adults are at risk of suicide. Suicide is a problem that happens across the lifespan, and a lot of people don't know that older adults have one of the highest rates of suicide. In fact, recent statistics say as many as an older adult dies every 65 minutes in the United States. And so things like loneliness and social isolation, we know from existing suicide research, are contributing factors. And we also know loneliness is dangerous and loneliness is lethal. And so really wanting to understand and identify that older adults are at risk of suicide is the why behind this, and how unique nutrition services is as a method to combating suicide among older adults. Home delivered meal volunteers and providers may often be the only source of regular connection. And so being able to equip them with the skills to know not just how to identify if they might be at risk of suicide, but how to respond and how to keep them safe from suicide is the why behind what we do.
What has worked well for your project?
It's something that, when we got kind of through the structure of how to accomplish this and kind of worked out some of the process, seeing how the volunteers who make these calls, and they're the ones that they get this training, that they learn skills to intervene, they're getting as much out of these connections as the older adults that we're connecting them with. And that's something in the suicide intervention and suicide research, a mutually beneficial relationship, some form of reciprocal care is actually a really good critical factor in preventing suicide.
What are some challenges your project faced?
We're trying to determine the effectiveness of this. We're trying to determine, does this work? And losing participants is always challenging, and that can be because of death, of passing away. It can be because of moving away or moving out of their home in the community and into a nursing home or assisted living facility or something like that. I'm really proud of our team and how we've worked to combat that, and how we've worked to try to negate some of the attrition that we've experienced. And I think another piece that's really challenging is oftentimes the folks who would benefit the most from this intervention are often the hardest ones to reach. The people who are the most lonely and the most isolated, and that's just something that we're constantly working to try to solve, to try to figure out how to most effectively reach and keep these folks connected.
How did you find appropriate partners/partner organizations?
Our previous work with ACL and the incredible support we have from ACL really enabled us to have and maintain and connect with strong, robust community partners in this. It started with us kind of explaining our work and getting connected with AAAs in the area that we work. We're in the Metro Atlanta area, so getting connected with AAAs, getting connected with some nonprofits, really just trying to understand what does the nutrition service look like in the aging network in Georgia. And I would say our strong connections with and support from ACL made that successful.
What funding sources have you utilized or will you utilize?
From this work and from what we've done, we've established a connection with the North Carolina Division of Aging Services, and we're really excited about that. We've had the opportunity to train some of their key personnel in the interventions that we utilize in our innovation. We're excited to see where that goes, and really hoping that we can start to kind of start with a few other states to determine how this works in their systems.
How will this project be sustainable once your grant period is done?
This project specifically was about determining, does this innovation work? Does this work? Is it doing what we hope that it does? So we're very much in the rigor of the research with this. And implementation and dissemination and sustainability are very important goals to our work in this, and we're also still very much in the beginning of understanding how does this work and how can we learn how it works to then take it to other places and to embed it within systems. And so, we know implementation science is an entirely other discipline that we're working on and striving toward. And so I think to do that, having more opportunities for funding from ACL, from other entities to continue the evaluation and dissemination of this project.
What stakeholders do you need buy-in from?
Really getting buy-in from leadership, from the AAA level, from the level of a county, of senior center directors, just understanding the value of what this is, made the work of getting connected with volunteers and getting connected with older adults who would be willing to be participants and be contributing to this science, right? That made that process a lot more effective to have the leadership from those stakeholders across the network.
What advice do you have for trying to replicate a similar project?
If you're doing a similar type of intervention, especially one that involves mental health, I would say the best piece of advice would be to really share your intervention with the leadership. Even if the person that you're connecting with, if they're not going to, receive a training to be a volunteer per se, if you can offer the training that you're trying to get embedded within the system to that leadership, they will see the value of it. And I think that's been so helpful and so effective in our work.
How do I get started?
Well, we're right in the middle of determining, is this effective? Does this work? We're in the middle of the research of that. And so I would say if this is something that you're interested in, reach out to us. We'd love to know how we could be supportive and what some next steps could look like moving forward. We're hopeful that we'll have even more opportunity to take this beyond determining its effectiveness and really into how do we embed this within the nation.
What do you wish you would have known prior to beginning the project?
Things will take longer than you think they will. It's really the hard work to do community-based suicide prevention and intervention. And the nutrition services, home delivery meal providers are lifelines. And it's just incredible to see how meeting these needs of being able to equip providers and volunteers with the skills to identify and respond to suicide, it's incredible. So I would say, if I could go back in time, I'd say it's hard work and it's some of the best work you'll ever do.